Hello, my name's Claire. I'm one of the nurse specialists and one of the clinical endoscopists here in the endoscopy department at Derriford Hospital. I'll be talking to you today about gastroscopy test. When you arrive on the endoscopy unit, you will report to reception, where our reception team will check your name and address and date of birth with yourself, and then ask you to take a seat in our reception area. One of the nursing team will then call you, who will then take you to one of our check-in rooms and go through that same information again and any additional medical information that they require. They will also ask you if you are wanting to have throat spray for the procedure. This numbs the throat. It is sprayed 10 sprays to the back of the throat, which numbs for half an hour. Or you may decide to have sedation. The sedation that we use here is a conscious sedation. It doesn't put you to sleep. You are awake and aware of what's going on. However, you should hopefully be nice and relaxed. Some endoscopists may give you some throat spray as well as the sedation. If you are having sedation, you are usually cannulated. This is a small tube which is placed into one of your veins so that we can administer the sedation when you are in the room and ready for your gastroscopy test. You will be then asked to sit back out into the reception until the procedure is ready to be carried out. One of the nurses from your procedure room will come to collect you from the reception and bring you into your procedure room, where they will introduce you to your endoscopist and the rest of the nursing staff. We will then sit you on the side of your bed. You can remain clothed. You do not need to take off your shoes. You may just need to remove any items that are around your neck. If you have any dentures, these will be asked to be removed. And if you have any tongue jewellery or any other mouth jewellery, this may need to be removed also. At that point, we will go through the consent form with you, which you would have previously read and signed, and we will go through this in a bit more detail, making sure that you understand or have any questions about the procedure. Once this is completed, we will then go through, if you're having the throat spray, which we will then spray your throat and make it nice and numb and get you into the position which will be on your left side. If you are having sedation, you will go onto your left side, and then once the mouth guard is put in place, which is a plastic mouth guard which is there to protect your teeth, your gums, and also to protect our scope. This is put in place first before any sedation is given, and then you will have some oxygen put up your nose on a low flow rate whilst the procedure is carried out. This is a relatively short procedure and takes about 3 to 5 minutes to complete. Depending on what you have been referred for the test for, there may be some routine samples. This is biopsies, which are about the size of a breadcrumb, so not very big, and these will be carried out during the procedure as required. If we do see anything that looks red or inflamed at all during the procedure, we may take additional samples, but all this will be explained to you afterwards when your report is given to you. So once you are lying on your side and we're ready to begin, we will then start the procedure. Sometimes it can be a bit uncomfortable at the back of the throat. This is very quick. The camera is placed nice and slowly over the back of the tongue and down into the esophagus. Once the camera is on its journey down the esophagus and into the stomach, we will be inflating with lots of air. And this is so that we can expand everything nicely so that we can see all the lining of what we need to be looking at. We will then proceed all the way to the small bowel. And usually on the way back is when we will take any samples as required. On removal of the scope, this is done nice and gently, and you should be kept comfortable at all times. There will be a nurse at the head end who will be looking after you throughout and looking after your airway and removing any secretions that are in your mouth using a suction catheter like they would use at the dentist. Your oxygen levels and your pulse will be monitored throughout the procedure and afterwards. If you are having throat spray after the procedure is completed, you will be able to leave straight from the room after receiving your report. If you are having sedation, you would need to go to our recovery area afterwards for half an hour to be monitored before you are able to go. If you are having sedation, you would need to have someone who can collect you and look after you at home for 24 hours. And there are things to avoid, like drinking any alcohol, not taking any sleeping tablets, not signing any legally binding documents or operating any machinery. If you are having a throat spray, you are able to leave from the room and continue your day as normal. Your report will be given to you either in the room or recovery, and the same copy will also be sent to your GP. Any biopsies that are taken, the results of these will be followed up with your referring physician. That may be a consultant within the hospital or your GP.